Hello, my name is Tsui, and this is a mock interview for a nurse practitioner position. What are your short and long range goals, and how do you expect to achieve them? Short term, I want to become a confident and well-rounded primary care provider. I am focused on strengthening my diagnostic skills and improving my ability to manage common chronic conditions like diabetes, hypertension, asthma, and metabolic health. I plan to do that through mentorship, regular case review, and staying up to date with evidence-based guidance. Long term, I see myself practicing prevention-focused family medicine and helping to build a team-based wellness center. I'll work towards that by continuing my education in functional health and collaborating with clinicians who value proactive root cause care while staying grounded in evidence-based medicine. What motivates you? What motivates me is helping patients avoid unnecessary suffering. In surgery, I saw patients lose limbs or visions from uncontrolled diabetes, things that were preventable. That stuck with me. I realized I don't just want to treat complications, I want to stop them from occurring in the first place. In my opinion, the greatest success isn't procedure, it's preventing one from ever happening. What does patient-centered care mean to you? Patient-centered care means that the plan has to fit the patient. It's not just textbook. Everyone has different beliefs, financial limitations, educational levels, and readiness to change. What works perfectly for one might not work for the other. For example, giving someone a perfect diabetic plan doesn't help if it's unrealistic for their lifestyle. Or if someone is afraid of needles, putting them on a weekly injection might not be a good idea. My role is to help them, not just to hand them the instructions or the perfect plan. All patients' plan will be different, but the perfect one is the one that patient can actually follow. How do you interact with families and patients? Throughout my career, I've gotten used to talking to patients and family during stressful moments, and that helped me to be very good at establishing rapport with patients and their families from a wide range of ages and backgrounds. I focus on explaining things in simple language, checking understanding with teachback, and acknowledging fear before I move into instructions. I also remind them that we are a team and actively listen to feedback from the patients and their families during our encounters. Tell me about your greatest achievement and greatest disappointment. My greatest achievement was progressing from surgical tech to RN first assist, and now family nurse practitioner. Each step took commitment and discipline. It reflects how serious I am about growth and expanding my impact in patient care. My greatest disappointment was watching preventable complications from chronic illnesses that end up in surgery, especially amputations from uncontrolled diabetes. It was hard seeing something that could have been avoided. Those kind of disappointments shaped my career directions towards family practice. Tell me about the best and worst bosses you ever had. The best bosses I've ever had were approachable and willing to teach. They correct mistakes privately and focus on helping you improve your clinical thinking. That builds confidence and patient safety. The worst bosses were the ones who discouraged questions, therefore creating a culture of silence and creating dangerous situations for the patients. From that, I learned how important open communication is. How do you handle stress? I handle stress by staying organized and systematic. The OR trained me to stay calm under pressure. I prioritize urgent issues first, break down complex problems into steps, and ask for help early when needed. Preparation helps a lot too. When I prepare well, stress decreases significantly. What are you looking for in this job? I'm looking for a collaborative environment with strong mentorships early on. I want exposure to diverse primary care conditions and the opportunity to grow. I'm not just I'm not looking for just a job. I'm looking to become a strong provider in this organization. What constructive criticisms have you received? Early in my career, I was told I tend to take on too much on myself instead of delegating. Over the time, I've learned that healthcare is a team effort. Delegating appropriately actually improves safety and efficiency. Now I'm much more intentional about teamwork and communication. Why did you want to become a FNP? During my surgical career, I repeatedly saw advanced diseases that start as manageable primary care problems. Uncontrolled diabetes, hypertension, colon cancer, infections. I realized my biggest impact wouldn't be in the operating room after complications. It would be before they happened. Family practice allowed me to educate, screen for cancer, prevent disease progressions, and manage chronic illnesses. This is what truly drew me to becoming an FNP.